This video is about joints. Joints are where bone meet with other bones. Now there's 206 bones in the human body, and there's several different ways that those bones begin to meet together. Now if those joints are deep, then the chances are that they're a very stable joint. But that stability kind of compromises the mobility. So joints that are more superficial are way more mobile, but they're a little less stable. There's three major types of joints, and there's at least two different ways that we can categorize joints. Like we could categorize joints structurally, we can categorize them more like functionally. But here are some types of joints: synovial joints, cartilaginous joints, fibrous joints. The synovial joints are freely movable joints. Cartilaginous joints are joined by hyaline cartilage or sometimes fibrocartilage, whereas the fibrous joints are joined by fibrous connective tissue. And there's three different kinds of fibrous joints. Here are the three kinds of fibrous joints. The suture joints, that's what you would find in your head. So suture joints are joined together at your skull bones. In infants, that cartilage is fairly weak and very separated from the major bones of the skull, which allows the baby's skull to squish together quite a bit. In an infant, those are called fontanelles, but then as you get older, the cartilage hardens into bone. Syndesmosis joint is the joint that we would find in like the forearm or the lower leg, the tibia, fibula, the radius, ulna. And what that means is that those bones are fastened together by a band of ligaments in this case. So this interosseous membrane in between bones, that membrane. Domphosis joints, or like the joint just means like fastened in or fastened with a bolt. And if you look carefully at the joint that makes up your teeth, you can see these connective tissue that looks like bolts. Now, a tooth is not a bone, it's a different organ, but this kind of joint is a peg and socket kind of joint, and these are immobile kinds of joints. A cartilaginous joint is a joint where it goes bone, cartilage, bone. So typically here, we find it in the vertebral column. We also find cartilaginous joints in your ribs. So those are the two major kinds. There's two different types of cartilaginous joints. There's the synchondrosis kind of joint and the symphysis kind of joint. So the joint that we're looking at here, synchondrosis type of joint, it's where like the pelvis bones kind of grow together, or the rib bones grow in together with the sternum. A symphysis joint, symphysis just definitely means like that the bones are growing together. We find those in the pubis bones, right at the front of the pelvis, where they're joined together by some fibrocartilage, but that cartilage will harden up over time. A synovial joint is a freely movable joint. So articulate means to move, like arthro, that means joint. Articulate means to move. Articular cartilage is going to provide this kind of cushion / lubricant in these very mobile joints. Synovial fluid also provides quite a bit of shock absorbing and lubrication. Notice that it's produced by synovial membrane. What's the difference between a tendon and a ligament? So tendons are going to connect muscle to bone, whereas ligaments connect bone to bone. Both of those are connective tissue. Ligaments are usually much more dense than tendons. Synovial joints have a wide variety of types of joints that allow a wide variety of movement. For example, a ball and socket joint allows kind of a circular sort of motion, so shoulders and hips. Pivot joint allows some rotation, some turning. Whereas like a saddle joint, like your thumb, or a hinge joint, open and closing, like your elbow and your knee are examples of that. Condylar joint in between your knuckles, and a plane joint in your wrists. Now, some joints have a little extra shock absorber, like a little extra sac called a bursa. And if that bursa gets inflamed, we call that bursitis. There's a variety of locations for this bursa, like where this bursa can be. So one example is that the bursa could be between the skin and the underlying bone, or that's a subcutaneous bursa. Whereas sometimes it's between the muscle and the bone. That's a submuscular bursa. And sometimes it's between the tendon and the bone, which is a subtendinous bursa. Again, if that bursa gets inflamed, we call that bursitis. Here's another look at a variety of the types of joints. Now remember that these joints are going to be held together by ligaments, and that there's several different types of ligaments. Like an extrinsic ligament is going to be outside of the articular cartilage. An intrinsic ligament is going to be inside or into the wall of the articular cartilage, whereas an intracapsular ligament is going to be inside the articular cartilage. So depending on where those ligament locations are, that's going to determine like that type of ligament, and a lot of times what that ligament is doing in that joint. Synovial joints are movable joints, which means they can create some kinds of movement. Supination and pronation just means to turn so it's face up, that's supine, or rotate so that it's face down, that's prone. Protraction means to stick out, like your jaw protracts. Retraction means to draw back in. Flexion means you're narrowing the angle of the joint, whereas extension means you're opening the angle of the joint. If it goes beyond the normal angle, we call that hyperextension. Circumduction means you're going in a circle. Adduction means you're adding it to your body, you're bringing it in closer to the midline, whereas abduction, like you're being abducted by aliens, it's being taken away from you. Rotation means that it rotates, it's going to move from side to side. Elevation means that you raise it, whereas depression means that it goes down. Your hands and feet have some additional unique kinds of movements, like dorsoflexion means you're pointing your toes up towards your nose, whereas plantar flexion means you're pointing your toes like a ballerina. Inversion, you're moving your feet in, whereas eversion, you're moving them out. Radial flexion, you're moving toward the radius, that's the thumb side, whereas ulnar flexion, you're moving toward the ulna, that's the pinky side. Abduction, you're spreading them out, they're going away. Opposition, like between your thumb and your pinky, we call that like opposable thumbs, like you're able to grip something like that. Let's look at some of the major joints in the body. The first one is the temporomandibular joint, sometimes TMJ joint. That allows your mouth to open and close. If you get punched really hard in the jaw, it might cause dislocation of that joint. Or if your jaw gets pulled down, like open too wide, it might cause dislocation of that joint. This is a glenohumeral joint. Gleno because of the glenoid socket in the scapula. Humerus because of the upper arm bone. This is a very shallow joint. It's a ball and socket joint, so you have that circumduction kind of motion, but often it's injured because of repetitive use that can cause osteoarthritis. But because of that shallowness, sometimes your shoulder can get dislodged if you're not careful. Humero-ulnar joint is between the humerus and the ulna, that's your elbow joint. Tibiofemoral joint is between your tibia and your femur, that's your knee joint. So in your elbow joint, the humero-ulnar joint, one of the major problems is hyperextension. In other words, opening that joint beyond its normal range, that can cause a lot of damage. Now there are ligaments that are going to try to hold that together, but if there's too much pressure, then that joint will give away. The knee joint is in fact the largest joint, the tibiofemoral joint. And that's because there's all these articulations, including the patella, which is another bone involved. So all the attachments between the ligaments. So the anterior ligaments are on the anterior side, the front. Then you have like medial ligaments and lateral ligaments that go around that knee joint to stabilize it. The hip joint is a ball and socket joint, so you have the ball of the femur fitting into the pelvis. In this case, the hip bone is often prone to osteoporosis. So hip replacements are fairly common, especially in elderly patients. The final one that we'll look at is the talocrural joint. So this is your ankle joint. Often it's beset by strains and sprains. So the stretching or pulling of a ligament is called a sprain, whereas if it's a tendon, it's called a strain. So if you have a problem with spraining your ankle, the treatment is RICE: rest, ice, compression, elevation. Here are some typical joint disorders. Osteoarthritis is an inflammation because of overuse. Rheumatoid arthritis, on the other hand, is an inflammation, but this time it's autoimmune. So the difference is osteoarthritis, you'll see it in one shoulder, let's say. Rheumatoid arthritis, you'll see it in both. Bursitis is an inflammation of that bursa. Dislocation, typically more with shallow joints like your shoulder joint. Gout is when there's these crystallization is happening and is starting to irritate the ligaments and tendons that are making up the joint. These uric acid crystals will start to form there, and it just kind of grates against those tendons and ligaments. Rheumatism is an inflammation often caused by rheumatoid arthritis. So it's an inflammation in the joints that is very uncomfortable. So hopefully this overview of joints kind of helps you get a roadmap to learning about this topic.